Are you or your loved one battling cancer? Anemia, a common side effect of cancer treatment, can further exacerbate the challenges patients face. In this video, we will explore two medications commonly used to address anemia in cancer patients, Neulasta and Procrit. Neulasta, a brand name medication, is designed to stimulate the production of white blood cells, helping to prevent infection. On the other hand, Procrit, also known as epoetin alfa, stimulates the production of red blood cells, easing the fatigue and shortness of breath associated with anemia. Both medications aim to improve the quality of life for cancer patients by addressing anemia symptoms. But which one is right for you or your loved one? In this comprehensive comparison, we will delve into the effectiveness, side effects, and cost of these medications. We will also discuss factors to consider when making a treatment decision, such as the type of cancer, patient health, and doctor recommendations. So, if you're seeking valuable insights into Neulasta and Procrit for managing anemia in cancer patients, read on to gain a clearer understanding of these medications and make informed decisions about treatment options. Understanding anemia in cancer patients. Anemia is a common side effect experienced by many cancer patients undergoing treatment. It occurs when the body lacks enough red blood cells to carry oxygen to the tissues. This can result in fatigue, weakness, shortness of breath, and a decreased quality of life. Anemia in cancer patients can be caused by factors such as chemotherapy, radiation therapy, or the cancer itself. Managing anemia is crucial in improving the well-being and outcomes of cancer patients. Two medications commonly used to address anemia in cancer patients are Neulasta and Procrit. While both medications aim to alleviate anemia symptoms, they work in different ways. In the following sections, we will explore the key features, effectiveness, side effects, and considerations when deciding between Neulasta and Procrit. Neulasta, an overview of the medication. Neulasta is a brand name medication that belongs to a class of drugs known as colony-stimulating factors. Its primary function is to stimulate the production of white blood cells in the bone marrow, which helps prevent infections in cancer patients. Neulasta is typically administered as a single injection within 24 hours after chemotherapy. It works by targeting a specific protein called granulocyte colony-stimulating factor, G-CSF, receptor, stimulating the production of white blood cells. The effectiveness of Neulasta in managing anemia in cancer patients primarily lies in its ability to prevent infections. By boosting the production of white blood cells, Neulasta helps strengthen the immune system, reducing the risk of infections that can be particularly dangerous for individuals with compromised immune systems. However, it is important to note that Neulasta does not directly address the production of red blood cells, which are responsible for carrying oxygen throughout the body. Neulasta is generally well tolerated by patients, but some common side effects may include bone pain, headache, fatigue, and injection site reactions. It is essential to discuss any potential risks or concerns with a healthcare professional before starting Neulasta treatment. Procrit, an overview of the medication. Procrit, also known as epoetin alfa, is a medication that stimulates the production of red blood cells. It belongs to a class of drugs called erythropoiesis-stimulating agents. Procrit is typically administered through injections either subcutaneously or intravenously. It works by mimicking the action of a hormone called erythropoietin, which is responsible for regulating red blood cell production in the body. The primary benefit of Procrit is its ability to increase red blood cell production, which can alleviate anemia symptoms such as fatigue and shortness of breath. By boosting the number of red blood cells, Procrit helps improve oxygen delivery to the tissues, enhancing the overall quality of life for cancer patients. It is important to note that Procrit should be used in accordance with the specific guidelines provided by healthcare professionals. Like any medication, Procrit does come with potential side effects. Common side effects may include high blood pressure, headache, joint pain, and flu-like symptoms. It is crucial to discuss the risks and benefits of Procrit treatment with a healthcare provider to ensure it is the appropriate choice for managing anemia in individual cases. The differences between Neulasta and Procrit. While both Neulasta and Procrit aim to address anemia in cancer patients, they differ in their mechanisms of action. Neulasta primarily focuses on stimulating the production of white blood cells, helping to prevent infections. On the other hand, Procrit targets the production of red blood cells, which can alleviate anemia symptoms such as fatigue and shortness of breath. When considering the choice between Neulasta and Procrit, it is essential to understand the specific needs and circumstances of the patient. Factors such as the type and stage of cancer, overall health, and individual treatment plan should be taken into account. Additionally, consulting with a healthcare professional is crucial to make an informed decision based on the patient's unique situation. Effectiveness of Neulasta in treating anemia in cancer patients. Neulasta has proven to be effective in preventing infections in cancer patients. By stimulating the production of white blood cells, Neulasta helps strengthen the immune system, reducing the risk of potentially life-threatening infections. However, it is important to note that Neulasta does not directly address the production of red blood cells, which are responsible for carrying oxygen throughout the body. For cancer patients experiencing anemia symptoms such as fatigue and shortness of breath, Neulasta may not provide the desired relief. In such cases, alternative treatments such as Procrit may be considered. It is crucial to discuss the effectiveness of Neulasta in addressing anemia with a healthcare professional to determine the most suitable treatment approach. Effectiveness of Procrit in treating anemia in cancer patients. Procrit has shown effectiveness in managing anemia symptoms in cancer patients. By stimulating the production of red blood cells, Procrit helps improve oxygen delivery to the tissues, reducing fatigue and shortness of breath. This can significantly enhance the quality of life for individuals undergoing cancer treatment. However, it is important to note that not all cancer patients may benefit from Procrit treatment. Certain factors, such as the underlying cause of anemia or specific cancer treatments, may influence the effectiveness of Procrit. Healthcare professionals play a crucial role in assessing the individual's needs and determining the appropriate course of treatment. Side effects and risks of Neulasta. While Neulasta is generally well tolerated by patients, there are potential side effects and risks to consider. Common side effects may include bone pain, headache, fatigue, and injection site reactions. In some cases, Neulasta can cause more severe side effects such as allergic reactions or damage to the spleen. It is important to discuss any concerns or potential risks with a healthcare professional before starting Neulasta treatment. Side effects and risks of Procrit. Like any medication, Procrit does come with potential side effects and risks. Common side effects may include high blood pressure, headache, joint pain, and flu-like symptoms. In rare cases, Procrit can lead to more severe side effects such as blood clots or an increased risk of certain types of cancer. It is crucial to discuss the risks and benefits of Procrit treatment with a healthcare provider to ensure it is the appropriate choice for managing anemia in individual cases. Choosing between Neulasta and Procrit for anemia treatment. When deciding between Neulasta and Procrit for anemia treatment in cancer patients, several factors should be considered. The specific type and stage of cancer, overall health, and individual treatment plan all play a role in determining the most appropriate medication. Additionally, consulting with a healthcare professional is crucial to receive personalized advice based on the patient's unique circumstances. It is important to weigh the potential benefits and risks of each medication. For individuals at a higher risk of infections, Neulasta may be the preferred option. On the other hand, Procrit may be more suitable for individuals experiencing anemia symptoms such as fatigue and shortness of breath. Collaborating with a healthcare professional ensures an informed decision that takes into account the individual's needs and goals. Conclusion: anemia can significantly impact the well-being and quality of life for cancer patients. Neulasta and Procrit are two medications commonly used to address anemia symptoms in this population. While Neulasta focuses on stimulating the production of white blood cells to prevent infections, Procrit targets the production of red blood cells to alleviate fatigue and shortness of breath. When making a treatment decision, it is crucial to consider factors such as the type of cancer, overall health, and individual treatment plan. Consulting with a healthcare professional is essential to receive personalized advice based on the patient's unique circumstances. Ultimately, the goal is to choose the medication that provides the most effective relief for anemia symptoms while minimizing potential risks. By understanding the differences, effectiveness, side effects, and considerations of Neulasta and Procrit, cancer patients and their loved ones can make well-informed decisions about their treatment options and work towards improving their quality of life.